fluids and electrolytes. 15 practice questions. Let's get started. Question 1. The nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dyspneic, and crackles are audible on auscultation. What additional manifestations would the nurse expect to note in this client if excess fluid volume is present? 1. Weight loss and dry skin. 2. Flat neck and hand veins, and decreased urinary output. 3. An increase in blood pressure and increased respirations. 4. Weakness and decreased central venous pressure CVP. What is the answer? 3. An increase in blood pressure and increased respirations. Rationale: a fluid volume excess occurs when fluid intake or fluid retention exceeds the fluid needs of the body. Assessment findings include cough, dyspnea, crackles, tachypnea, tachycardia, elevated blood pressure, bounding pulse, elevated CVP, weight gain, edema, neck and hand vein distension, altered level of consciousness, and decreased hematocrit. Dry skin, flat neck and hand veins, decreased urinary output, and decreased CVP are noted in fluid volume deficit. Question 2. The nurse reviews a client's record and determines that the client is at risk for developing a potassium deficit if which situation is documented? 1. Sustained tissue damage. 2. Requires nasogastric section. 3. Has a history of Addison's disease. 4. Uric acid level of 9.4 milligrams per dl. What is the answer? 2. Requires nasogastric section. Rationale: the normal serum potassium level is 3.5 to 5.0 mg per liter. A potassium deficit is known as hypokalemia. Potassium-rich gastrointestinal fluids are lost through gastrointestinal section, placing the client at risk for hypokalemia. The client with tissue damage or Addison's disease and the client with hyperuricemia are at risk for hyperkalemia. Question 3. The nurse reviews a client's electrolyte laboratory report and notes that the potassium level is to 0.5 mg per liter. Which patterns would the nurse watch for on the electrocardiogram ECG as a result of the laboratory value? Select all that apply. 1. U waves. 2. Absent P waves. 3. Inverted T waves. 4. Depressed ST segment. 5. Widened QRS complex. What is the answer? 1. U waves. 3. Inverted T waves. 4. Depressed ST segment. Rationale: the normal serum potassium level is 3.5 to 5.0 mg per L. A serum potassium level lower than 3.5 indicates hypokalemia. EKG changes include shallow, flat, or inverted T waves, ST segment depression, and prominent U waves. Absent P waves are not a characteristic of hypokalemia, but may be noted in a client with atrial fibrillation, junctional rhythms, or ventricular rhythms. A widened QRS complex may be noted in hyperkalemia and hypermagnesia. Question 4. Potassium chloride intravenously is prescribed for a client with heart failure experiencing hypokalemia. Which actions would the nurse take to plan for preparation and administration of the potassium? Select all that apply. 1. Obtain an intravenous for infusion pump. 2. Monitor urine output during administration. 3. Prepare the medication for bolus administration. 4. Monitor the IV site for signs of infiltration or phlebitis. 5. Ensure that the medication is diluted in the appropriate volume of fluid. 6. Ensure that the bag is labeled with the volume of potassium in the solution. What is the answer? 1. Obtain an intravenous for infusion pump. 2. Monitor urine output during administration. 4. Monitor the IV site for signs of infiltration or phlebitis. 5. Ensure that the medication is diluted in the appropriate volume of fluid. 6. Ensure that the bag is labeled with the volume of potassium in the solution. Potassium chloride administered intravenously must always be diluted in IV fluid and infused via an infusion pump. KCl is never given by bolus. IV push can result in cardiac arrest. Potassium should be diluted with diluent or fluid. The IV bag must be labeled with the volume of potassium it contains. Potassium chloride is irritating to the veins, and there is risk of phlebitis and infiltration. The nurse must contact the physician if the urinary output is less than 30 milliliters per hour. Question 5. The nurse is assessing a client with a lactose intolerance disorder for a suspected diagnosis of hypoglycemia. Which clinical manifestation would the nurse expect to note in the client? 1. Twitching. 2. Hypoactive bowel sounds. 3. Negative Trousseau sign. 4. Hypoactive deep tendon reflexes. What is the answer? 1. Twitching. Rationale: signs of hypoglycemia include paresthesias followed by numbness, hyperactive deep tendon reflexes, and a positive Trousseau's or Kvostek's sign. Additional signs of hypocalcemia include increased neuromuscular excitability, muscle cramps, twitching, tetany, seizures, irritability, and anxiety. Gastrointestinal symptoms include increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. Question 6. The nurse is caring for a client with Crohn's disease who has a calcium level of 8 milligrams per dl. Which patterns would the nurse watch for on the electrocardiogram? Select all that apply. 1. Peak T wave. 2. Widened T wave. 3. Prominent U wave. 4. Prolonged QT interval. 5. Prolonged ST segment. What is the answer? 4. Prolonged QT interval. 5. Prolonged ST segment. The normal serum calcium level is 9 to 10.5 milligrams dl. A serum calcium level lower than 9 milligrams dl indicates hypocalcemia. EKG changes that occur in a client with hypocalcemia include a prolonged QT interval and prolonged ST segment. Peak T waves occur with myocardial infarction. A shortened ST segment and a widened T wave occur with hypercalcemia. ST depression and prominent U waves occur with hypokalemia. Question 7. The nurse reviews the electrolyte results of a client with chronic kidney disease and notes that the potassium level is 5.7 mg per liter. Which patterns would the nurse watch for on the cardiac monitor as a result of the laboratory value? Select all that apply. 1. ST depression. 2. Prominent U wave. 3. Tall peak T waves. 4. Prolonged ST segment. 5. Widened QRS complexes. What is the answer? 3. Tall peak T waves. 5. Widened QRS complexes. Rationale: the client with chronic kidney disease is at risk for hyperkalemia. A serum potassium level greater than 5.0 mg per liter indicates hyperkalemia. EKG changes associated with hyperkalemia include flat P waves, prolonged PR intervals, widened QRS complexes, and tall peak T waves. ST depression and a prominent U wave occur in hypokalemia. A prolonged ST segment occurs in hypocalcemia. Question 8. Which client is at risk for the development of a sodium level at 130 mg per liter? 1. The client who is taking diuretics. 2. The client with hyperaldosteronism. 3. The client with Cushing's syndrome. 4. The client who is taking corticosteroids. What is the answer? 1. The client who is taking diuretics. Rationale: the normal serum sodium level is 135 to 145 mg per liter. A serum sodium level of 130 mg per liter indicates hyponatremia. Hyponatremia can occur in a client taking diuretics, the client taking corticosteroids, and the client with hyperaldosteronism or Cushing's syndrome are at risk for hypernatremia. Question 9. The nurse is caring for a client with heart failure who is receiving high doses of a diuretic. On assessment, the nurse notes that the client has flat neck veins, generalized muscle weakness, and diminished deep tendon reflexes. The nurse suspects hyponatremia. What additional sign would the nurse expect to note in a client with hyponatremia? 1. Muscle twitches. 2. Decreased urinary output. 3. Hyperactive bowel sounds. 4. Increased specific gravity of the urine. What is the answer? 3. Hyperactive bowel sounds. The normal serum sodium level is 135 to 145 mg per liter. Hyponatremia is evidenced by a serum sodium level lower than 135 mg per liter. Hyperactive bowel sounds indicate hyponatremia. The remaining options are signs of hypernatremia. In hyponatremia, muscle weakness, increased urinary output, and decreased specific gravity of the urine would be noted. Question 10. The nurse reviews a client's laboratory report and notes that the client's serum phosphorus phosphate level is 1.8 milligrams per dl. Which condition most likely caused this serum phosphorus level? 1. Malnutrition. 2. Renal insufficiency. 3. Hypoparathyroidism. 4. Tumor lysis syndrome. What is the answer? 1. Malnutrition. Rationale: the normal serum phosphorus phosphate level is 3.0 to 4.5 milligrams per dl. The client is experiencing hypophosphatemia. Causative factors relate to malnutrition or starvation and the use of aluminum hydroxide-based or magnesium-based antacids. Renal insufficiency, hypoparathyroidism, and tumor lysis syndrome are causative factors of hyperphosphatemia. Question 11. The nurse is reading a physician's progress notes in the client's record and reads that the physician has documented insensible fluid loss of approximately 800 milliliters daily. The nurse plans to monitor the client, knowing that insensible fluid loss occurs through which type of excretion? 1. Urinary output. 2. Wound drainage. 3. Integumentary output. 4. The gastrointestinal tract. What is the answer? 3. Integumentary output. Answer 3. Rationale: insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. Sensible losses are those of which the person is aware, such as through urination, wound drainage, and gastrointestinal tract losses. Question 12. The nurse is assigned to care for a group of clients. On review of the client's medical records, the nurse determines that which client is most likely at risk for a fluid volume deficit. 1. A client with an ileostomy. 2. A client with heart failure. 3. A client on long-term corticosteroid therapy. 4. A client receiving frequent wound irrigations. What is the answer? Answer 1. Rationale. Causes of a fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations, or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, and the presence of an ileostomy or colostomy. A client with heart failure, or on long-term corticosteroid therapy, or a client receiving frequent wound irrigations, is most at risk for fluid volume excess. Question 13. The nurse caring for a client with heart failure who has been receiving intravenous IV diuretics suspects that the client is experiencing a fluid volume deficit. Which assessment finding would the nurse note in a client with this condition? 1. Weight loss and poor skin turgor. 2. Lung congestion and increased heart rate. 3. Decreased hematocrit and increased urine output. 4. Increased respirations and increased blood pressure. What is the answer? 1. Weight loss and poor skin turgor. Assessment findings in a client with a fluid volume deficit include increased respirations and heart rate, decreased central venous pressure CVP, weight loss, poor skin turgor, dry mucous membranes, decreased urine volume, increased specific gravity of the urine, increased hematocrit, and altered level of consciousness. Lung congestion, increased urinary output, and increased blood pressure are all associated with fluid volume excess. Question 14. On review of the client's medical records, the nurse determines that which client is at risk for fluid volume excess. 1. The client taking diuretics who has tenting of the skin. 2. The client with an ileostomy from a recent abdominal surgery. 3. The client who requires intermittent gastrointestinal sectioning. 4. The client with kidney disease that developed as a complication of diabetes mellitus. What is the answer? 4. The client with kidney disease that developed as a complication of diabetes mellitus. Answer 4. Rationale. The causes of fluid volume excess include decreased kidney function, heart failure, use of hypotonic fluids, excessive irrigation of wounds and body cavities, and excessive ingestion of sodium. Kidney disease is a complication of diabetes mellitus resulting in fluid retention. The client taking diuretics, the client with an ileostomy, and the client who requires gastrointestinal sectioning are at risk for fluid volume deficit. Question 15. Which client is at risk for the development of a potassium level of 5.5 mg per liter? 1. The client with colitis. 2. The client with Cushing syndrome. 3. The client who has been overusing laxatives. 4. The client who has sustained a traumatic burn. What is the answer? 4. The client who has sustained a traumatic burn. Clients who experience cellular shifting of potassium in the early stages of massive cell destruction, such as with trauma, burns, sepsis, or metabolic or respiratory acidosis, are at risk for hyperkalemia. The client with Cushing's syndrome or colitis and the client who has been overusing laxatives are at risk for hypokalemia. How many correct answers did you get? Let's discuss in the comments section. Thank you for watching. Don't forget to like, comment, share, and subscribe to my channel.